As the city of Mumbai continues to remain the epicenter of coronavirus in India, there are also rising concerns among residents who fear a shortage of hospital beds and delay in testing. India Today conducts a status check. Take a look at this ground report.
The day the new Municipal Commissioner of Mumbai, I.S. Chahal, visited BYL Nair Hospital, Ashok Ramadugu's relative was waiting on the road outside this hospital, hoping to be admitted.
नायर हॉस्पिटल जाने के बाद वो लोगों ने जो डॉक्टर्स या नर्सेस वगैरह उन्होंने डायरेक्ट क्यू में खड़ा किया तो बोला लाइन में खड़ा रहो फिर हम लोग टेस्ट करेंगे जैसा वो बाहर आ गया वो पूरा पसीना से लपटा हुआ था कि ऐसा घबराहट उनके मन में आ गया ये लोग मुझे क्या कर रहे हैं.
Ironically, this death didn't even make it to India's COVID statistics because the hospital marked the dead on the death certificate as a suspected COVID patient.
Inconvenience to patients in Mumbai was on two fronts. First was getting a hospital bed and then getting tested. Rising number of cases led to shortage of hospital beds. A lot of hospital staff fell prey to COVID-19, which made hospital wary of admitting patients. At the same point of time, there was changing guidelines of testing by the BMC, which made it difficult for patients to get tested in time.
Despite assurances from the government, there is now a feeling in Mumbai that civic hospitals are running short on medicines, equipment, staff and hospital beds.
एक बेड पे तीन पेशेंट और जैसे बेड पे जब पेशेंट मरता है उनको भी इन लोग जल्दी से फटक से लेके नहीं जाते. नॉर्मल पेशेंट के पास 4-10 घंटा उधर बॉडी रखते.
Mumbai has 5 major public hospitals, 16 peripheral municipal hospitals and 6 specialty hospitals in addition to a large number of private ones. Shortage of beds is being reported for critical patients across dedicated COVID hospitals. These hospitals are equipped with ICU facilities and have ventilator support and are reserved for patients who are critical.
फैसिलिटी बन रही है MMRDA में. इस टाइम वहाँ पे हैंडिंग टेकिंग ओवर चल रहा है इन्वेंट्री का MMRDA और BMC का. 800 बेड की तैयारी हो चुकी है तो कल से हम वहाँ पे काम शुरू करेंगे अपना. तो बेड की कोई प्रॉब्लम नहीं है. इस टाइम हमारे पास सब मिला के 50,000 के ऊपर बेड हैं और हम जल्दी 1 लाख पे पहुंचने वाले हैं.
For doctors who are at the front line in the fight against COVID-19, the danger is more. The Maharashtra state government has decreased the quarantine period for doctors on duty from 7 days to 2 days, putting them at high risk. Dr. Mazhar Khan, a resident doctor, has not gone home since 24th of February because he's afraid he may infect his family.
5 days work and 2 days quarantine system. This is illogical. This doesn't serve the purpose. If any resident with 7-day work and 7-day quarantine, we already have 18 residents who are positive. With 5-day working and 2 days quarantine, it is going to affect us badly. And if one person turns out to be positive, and he will spread it to everybody because we don't have that break and we cannot monitor whether that person has really contracted the infection.
BMC maintains that there is no shortage of bed. Even ICUs are sufficient for now. But patients and their relatives tell a different tale. Not knowing how to deal with the pandemic has only aggravated the fear.
Now, the nationwide lockdown imposed to curb the spread of COVID-19 has also led to the issue of livelihood that has been lost for thousands of migrant workers. With no work, food or even money, these migrant workers in thousands are now leaving for their respective hometowns since the past few days. India Today's Ashutosh Mishra is on a journey along with a group of these migrants on the highway. Take a look at this ground report.
The mass migrant exodus continues. Braving the heat of May, carrying heavy baggages, covering miles with families including children, the Nowhere's people continue the long journey home. Migrants coming from Rajasthan, Gujarat and Maharashtra are being provided with government-arranged transport at the border, all the way to their hometowns in Uttar Pradesh and Bihar.
Here at the border of Jaipur in the state of Rajasthan, finally these laborers are being provided transportation, that's the government buses, and before departing from one city to their destination back in Uttar Pradesh and Bihar, these medical screening are being made compulsory. So the health department workers are here screening everyone, every labor worker who is leaving Rajasthan, Jaipur in these buses. First they have to queue up. Of course, social distancing indeed is a challenge, but for now, they are being screened here, the temperature is being checked. At the same time, the data here is being maintained, how many people are leaving.
सर अब यहाँ परेशानी हो रही है इसलिए जा रहे हैं वहाँ पर 2 महीने से हैं काम काज चले रहा खाने पीने को भी दिक्कत हो रही है इस चक्कर में
अब घर से आए गांव से 5-6-7 महीना हो गए काम उम कर रहे अब काम उम है नहीं बच्चों क्या करें भाई यहाँ
इसलिए छोड़ के जाना पड़ा
अब जाने तो मजबूरी है भाई खान पीने सरकार भी कहाँ ले दे
After reaching Uttar Pradesh, migrants are first taken to shelter homes in Agra. After food and first aid, begins the much-awaited ride home. At the Fatehpur Sikri Agra border, Uttar Pradesh roadways buses are being sanitized for the journey.
The mass exodus of the laborers, workers continue. I'm here in the Uttar Pradesh territory, the city Fatehpur Sikri, and that's the very famous mandi, which is now a temporary shelter for all the migrants who are arriving from Rajasthan, Gujarat, and Maharashtra. Here the arrangements made by Uttar Pradesh government and the local administration. In the temporary shelter, they are provided food. Now, all the arrangements for transportation being made by the Uttar Pradesh Transport Department, where the officials are noting down their destination. These buses are first sanitized and now they are being deported back to their places.
While some board buses for home, many wait for their turns, only to queue up quickly when the announcement is made.
रूट वाइज हम बसें भेज रहे हैं और हर रूट पे हम बस भेजेंगे नियरेस्ट डिस्ट्रिक्ट भेजेंगे
Many reached Agra after paying as much as rupees 3,000 to truck drivers to hitch a ride. Some say calls to government helplines went unanswered.
सर हम लोग की उम्मीद है कि वापस अब नहीं आएंगे सर नहीं जो भी हमारा है बिहार
कैसे चलेगा
बिहार में सर बिहार में सर रोजगार करेंगे बिहार में ही रोजगार हमारे बहुत है वहीं अब कमाएंगे खाएंगे जो मेरा खेत बाड़ी है वही करेंगे
लेकिन अब वापस नहीं आएंगे
नहीं आना चाहते
In the big rush, government order and unsafe travel and social distancing are openly flouted. Many are seen traveling on roof of trucks. When asked, they blame cops.
आपको डर नहीं लगा इतनी खुली ट्रक पर आप बैठ के जा रहे हैं?
नहीं पुलिस वाले ही बैठा है
कहाँ पर बिठाया पुलिस वालों ने?
ये पीछे कह रहे थे आप पैदल मत जाइए इसमें बैठ लीजिए
Many have traveled in jam-packed trucks, like cattle herded together, risking lives and facing infection threat.
सरकार ने इतना सारा पैकेज दे दिया कि काम चलेगा शुरू होगा ना तो आप लोगों को कुछ नहीं मिला आप लोग पहुंचे नहीं आप लोग कंपनी तक मदद नहीं पहुंचे
कोई सुविधा नहीं मिला सर आज तक
कुछ नहीं मिला
कोई सुविधा नहीं
ये सिर्फ दिखावा है कि महाराष्ट्र से इतना ट्रेनें चल रही है और आज तक कितना 5-5, 6-6 ऑनलाइन कर दिया लेकिन ऑनलाइन का कोई
राहत पैकेट आज तक एक भी नहीं मिला सर
राहत आया कुछ भी नहीं आया
One side the government says there are adequate arrangements made for these migrants to ensure they reach so safe home. But here on the ground, the reality is way different. This is a makeshift arrangement by these migrants where they also paid 2,000 to 2,500 rupees each. They made their arrangement themselves and now this truck which has already this temporary structure which is very risky and perhaps why their life remains under threat looking at the number of tragedies that unfolded across the country in several cities.
Many don't agree with the governments which pat their own backs over transport arrangements.
एक तो ट्रक में आप जा रहे हैं सरकार भी कह रही है ट्रक में मत जाइए पैदल मत जाइए व्यवस्था हो रही है
सरकार व्यवस्था देना फिर सरकार व्यवस्था कहाँ दे रही है सरकार तो केवल बंद कर दिया है सब कुछ
ना खाना,
महाराष्ट्र से कब चल
पानी मिल रहा, ना तो सेठ अपने यहाँ रख रहा है। तो
महाराष्ट्र से चल के 4 दिन हो गए,
4-5 दिन से हम लोग धूप में तप रहे हैं। सेठ क्या सरकार नहीं देख रही है?
Not everyone is lucky enough to get a transport. Govind and Sandeep are walking to Prayagraj, claiming no other option to reach home.
कितना दूर है प्रयागराज? आपको पता है कितनी गर्मी में कैसे जाएंगे आगे?
ऐसा कैसे जाएंगे, वैसे ही जाएंगे, देखिए
थोड़ा रेस्ट कर करके पहुंचेंगे। 24 किलोमीटर है।
ये भी पता चलोगा हाईवे पर कितनी सारी दुर्घटनाएं हुई हैं, इसीलिए सरकार कह रही है कि पैदल मत चलिए, बस से जा रही हैं।
बात सही है सर, लेकिन क्या करें।
Can India ensure they reach home safely? With Ashutosh Mishra, Bureau Report, India Today.
And now a ground report from Jammu and Kashmir. After 2 months of lockdown, markets in Jammu have reopened for the very first time today. The region is now in orange zones and the shopkeepers have decided to welcome this decision of the government. My colleague Sunil G. Bhatt bringing you this report.
It's day 1 of lockdown 4.0 here in Jammu and Kashmir, and the administration has announced a slew of relaxations. The districts here in Jammu and Kashmir have been redesignated as red, orange and green zones. Jammu district has been designated as an orange zone, and in orange zones markets can open now, and you can see that the markets here in Jammu district have opened after 2 months. We are right now at Jammu's famous Raghunath Bazaar, and here you can see that the shops have opened after 2 months. Keeper, he's the shop owner. We will directly speak to him. Aji, aapka naam?
I'm Nilambar Kullar.
Okay, Mr. Kullar, today you have opened your shop after 2 months.
Yeah,
okay.
Exactly.
How is the feeling now? Finally, you are able to open your shop.
Oh, we are very happy. Government has decided to open the shops after 2 months, but we have to take care of ourselves and others. We have to keep social distancing and all the other guidelines which government has given us.
Right.
So
government has asked that proper social distancing should be maintained in the shop.
Bilkul, we have to.
And you have to wear masks. You are already wearing.
Yeah.
So you can see that finally there is smile on the faces of the shopkeepers here at Jammu's Raghunath Bazaar. Now finally they hope to rebuild their lives, they hope to regain their livelihood. That's why now they are hopeful that people will come for shopping purposes and they can once again earn some money. They have faced heavy losses for last 2 months. With video journalist Neeraj Kumar, this is Sunil Bhatt reporting from Jammu for India Today.
Pune is one of the 2 cities in Maharashtra which is worst hit by coronavirus. The Pune Municipal Corporation is taking all necessary steps to contain the spread and also track infected people. Majority of residents, however, staying in congested areas where social distancing is becoming really difficult to maintain. India Today decided to visit one such spot in Pune's Premnagar slum area. The team of doctors were also accompanied by RSS volunteers, screening each and every household. The doctors revealed how it is difficult to test every citizen, with even summer temperature racing to as high as 40 degrees Celsius.
ये जो मेरे पीछे जो खड़े इसमें डॉक्टर्स भी है और वॉलंटियर्स है, दोनों है। प्रमुखता ये सब राष्ट्रीय स्वयंसेवक संघ तथा अखिल भारतीय विद्यार्थी परिषद ऐसे संगठनों से है। लगभग 80 से 90% इन दो संस्थाओं से है और 10-15% ऐसे है कि मेरे दोस्त है, संघ में नहीं है, लेकिन अभी ये सब देखा तो उनको ऐसा लगा कि मैंने जाना चाहिए, तो इस प्रकार से वो हमारे साथ जुटे हुए हैं।
I am a स्वयंसेवक with the राष्ट्रीय स्वयंसेवक संघ, and one day we call them मुख्य शिक्षक. He told me कि you have to go. There is a chance to offer service to the nation. Will you go? So once the calling has come from RSS, we do have to go. And as the doctors said right now, that people are not cooperative and all. See, these are doctors, people don't know them. But as we all know, RSS is spread across India. So what we have shakas in every locality. So basically people trust people who live with them. So if those people are with us, it is really helpful to gain the people's trust.
We were given a specific training before going into red zones. We were told the precautions which we have to take inside. So we were just taught to how to wear the PPE kit and also some basic knowledge of the gloves and all those things. The basic, the primary thing we do here is that we just know, we assist the doctors here and we help out in writing the names of the patients or the people who are affected there. So we also distribute according to the instructions of the doctors and the superiors. We distribute the medicines to the people inside who are affected in the red zone areas.
The International Cricket Committee is set to ban use of saliva on the ball as a measure against the spread of coronavirus. The players are used to using saliva on the ball, but this new advisory comes as a part of a series of changes that various sports are undergoing post-COVID-19. And India's off-spinner Harbhajan Singh gave his version to make the game more balanced between the ball and the bat.
Baju, what exactly does this mean? By not using saliva and by using sweat, why is it that the bowling fraternity is saying that the game is up?
Well, I think it's a very simple method. You know, why we use saliva to get the shine on the ball, and you know, on a newer ball like this, you know what I have in my hand, you don't need to put saliva. But even with the sweat, this ball you can shine easily.
You can shine it.
Yes, but once the ball gets old, little old, about 15-20 odd overs are gone, and then ball will become little old. Then you need to use the saliva to get the ball shine. And if you don't have the option to put the saliva, how are you going to shine the ball and how are you going to get the ball to swing? And if you'll not be able to swing the ball, whether it's a straight swing or a reverse swing, then how are you going to get the batsman out? And on conditions like, you know, Indian conditions, Pakistan conditions, Sri Lankan conditions, and for that matter, even sometime in Australia, you know, where the wickets are so flat.
Also, because these are extraordinary times for cricket, Baju. One simple thing, like in one-dayers, you have two different balls being used from either end in a 50-over games, which means that one ball is used for 25 overs. Why can't you do that in Test cricket till this coronavirus is there?
Well, that's a great suggestion. You know, I certainly feel that the bowler will appreciate if ICC can allow such move, you know, where bowler will also be part of the game. Otherwise, they will just become like a bowling machine. They'll come running, bowl, and will not be able to get the batsmen out. But this is a very good suggestion. You know, if they can have two balls, that will obviously bring back some sort of element of you know, that between bat and ball. You know, some kind of you know, fight between bat and ball. Otherwise, this will become purely a batsman's game, which already it is, but it will give little more edge to the batsman.
That's a wrap on this bulletin. For further news and updates, please log on to indiatoday.in for all coronavirus related updates and more. You can also download the application on your phones. Stay home, stay safe. Thank you for watching India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.